So thank you for joining us today, Anushi.
Thank you for having me.
Could you start by sharing with us the Misti mission?
So, hello everyone, good morning. So Misti's mission is singular but large. We want to get to the beautiful 8.1 billion people as of today within minutes, not days, not months. And that's what we're changing. And how we're doing that is through delivering advanced medicines, which I'll get to, using an advanced lung delivery system, which is hospital grade, that's actually sitting on the table right here. Hospital at home, this concept is not new. If you know someone with sleep apnea, my poor husband is one of them. Thank goodness he's not snoring anymore. Continuous positive airway pressure, CPAP, is now a home thing. You know, it's no longer reserved to the ICU. So we're now living and breathing an advanced piece of technology that's living in our homes. I want to take you back to the current era that we're living. We're living in a tripledemic. What that means is we've got COVID-19, influenza, and a virus called RSV, or the respiratory syncytial virus, all at interplay. There are some patient groups that are more at risk than others. For example, children. If you've got kids, like me, they get sick a lot. 6 to 8 infections, 10,000 children are hospitalised, and it's actually the 6th leading cause of death. I know, respiratory diseases can kill even today. If you're from an Aboriginal or Torres Strait Islander community, that's actually putting you at more risk. So that's $900 out of your pocket. What we're trying to do is change that. We've spoken to 244 parents and caregivers. We've spoken to GPs, pharmacists, specialists, and there is a gap. That is, we want to be part of the continuum of care right beyond the hospital all the way to the home. That's what we're trying to do.
So take us then a little bit back to the story behind Misti. You mentioned, you're a mother, you have children, and we need advanced care in the home. So talk us a little bit through the technology and its impact and the story behind Misti.
Yeah. So I grew up in a remote part of this world, in a small island, so small. But I wanted to be part of the next cutting-edge technology. I did not want to be left behind. And so what that meant is this kind of obsession started from a very young age, and I was also needle phobic. That's probably a conversation for another day. And my parents really struggled with that. So I guess that vision was there, and when I started my PhD, it was a totally accidental discovery that we discovered a way of transforming a liquid to a gas using sound waves in a way that's quite elegant, and now it's sitting right here. But we thought to ourselves, well, can we extend that? We're living in an age where we're taking vitamins at home, yeah? What about, genetic therapies? What about stem cells? What about vaccines? Can we deliver those exciting new therapies at your home? That's what I want to challenge your thinking today around.
So talk us a little bit more about that. So if, forgive me if I oversimplify, but you can take a form of medication, whether it be powder, liquid, or even cell therapy, and turn it into a mist so that it can be inspired. And therefore, you reshape the way that we look at the clinical setting. Mm-hmm. So walk us through a little bit in your mind, what is the doctor-patient relationship in that scenario?
Yep. So at the moment, we actually asked some doctors, so this particular group that are caring for children, and we asked, well, what are you happy with? What do you know? And they said, well, we're happy with anything. And I said, well, do you want to know more? Do you want to know that the medication that you prescribed is being delivered and there's compliance? And would you want to know that if it is not, would you want to course correct? Would you want to be part of that journey throughout? And so, well, then kind of the light bulb moment goes, well, yes, So we thought, well, we want to put all the data capability into this technology so that the clinician is now also part of the story at home. It's no longer that you're kind of managing everything on your own, but they're now part of the conversation. So it's forming that loop of conversation, the 360 view that we desperately need right now.
So extending that thought then, Anushi, if we can get the data at home and the doctor can treat you with an advanced therapy at home, what do you think that will do in terms of repurposing the clinical environment? What do you think will change in healthcare infrastructure, for example, in the way that we use our healthcare infrastructure?
So there's two elephants in the room that I want to get to. So there's a small one and a big one. The small one, I'll talk about the small one first. So we're living in an age, as I said, there's emerging diseases, the Tripledemic that I mentioned. Emerging diseases need creative solutions. It's simple as that. So I'm challenging the existing mode of delivering vaccines, other therapies, to think, I guess, beyond that. Our lungs are an amazing, surface that has got an exciting surveillance system and an immune system, ready to combat. So why not we use that and train it for the better? So that's the small elephant that I want to tackle. The bigger one is this factor around fear. What I want to say is normalizing, these exciting therapeutics, bringing them to home, much like the vitamins, I forgot to take them this morning. But, but then, if we can prime the clinician to say, well, complete the story. So the point where, the best care in the best doctors in the world now have access to the patient, for example, in Ghana. And what about when you're hospitalised? You've got hospital-acquired infections. That's a $45 billion problem. Can we avoid it? Do you like staying in the ED? Would you rather manage, if you can, early onset of disease before it gets too late? Would you rather rewind the time and change something earlier on? Because it all starts with a common cold, unfortunately. It is not common, but it can be quite serious. So we want to kind of get to the beginning of the story and help you. That's what we're trying to do.
And when listening to you speak, Anushi, it makes me think about how you can stay in your home environment and receive the medication. And so it allows us to, speaking to the previous panel around the built environment, it allows us to look at cities in a different way and plan cities in a different way now, because we can take advanced therapy out of the hospital and disperse it out into remote cities and into remote communities. And I think you were mentioning to me at one point that you could even mail out medication if we get to that point where we have enough infrastructure out there to support this kind of advanced therapy at home.
So we were trying to get to this is called Misti. We wanted to have Misti like a thermometer that you have at home. So want to add something to your toolkit that you're then empowered to use, and the medication is, as per guided by the clinician, dispersed through drones or the model. I'm painting a picture of 2050 or probably beyond that, but that's the future that I want to be part of.
So looking at that future, 5 to 10 years from now, how do you see Misti evolving, and what do you hope to achieve in terms of global healthcare delivery and access?
So when I started Misti, I wanted to get to everyone on the planet, right? The only way to get to everybody on the planet is to get to the weakest first, because our strength lies on the weakest. And the weakest is our vulnerable, so that's our aged care population, and then it's our children. And how do we get to that? So that's why I wanted to kind of put this technology in the forefront of that, which then allows us to kind of leave no one behind, including my younger self and my future self. And if we can achieve that, that would be success for me and Misti.
That sounds amazing. We have in this room a group of powerhouse people. How can they help you today, Anushi?
Great question. So we're trying to get to, I know, a crazy number, 3,000 patients in the next couple of months. We're getting ready for our formative study, so we love feedback. So if you've got access to patients or and specifically children, vulnerable groups, anyone that would love to, excited by the future that we are creating, I would love to have a chat. That's my little ask, and but anyone, please find me in the room next door. If you want to have a play and kind of think about what we're trying to do, yeah, I'm open to questions.
Thank you very much, Anushi.